Many times when patients come to see me, they have a good idea of what they think is going on with their body when they have concerns about their health. In this day and age, for better or for worse, we have access to so much information out there. And so it's not uncommon for people to have spent time looking things up online, using AI, going to social media forums, trying to find answers to the things that they might be affecting them. That's not dumb, that's human. And we all do it when we're uncomfortable, when we don't feel our best. We want answers. And if you're somebody who's ever felt like it was necessary to turn to the internet because you felt dismissed or rushed by your clinician, or you don't feel comfortable asking the questions that you want to ask, this video is for you. While I understand that tendency and oftentimes that need, I want to address why that may not be the best way to go about it. And if you follow to the end, I'm going to share with you what I think is a better alternative. What's going on, everybody? My name is Golfran Rivera. I am a family med PA, and I'm also the founder of True Care DPC. It's a holistic direct primary care practice here in beautiful Fayetteville, North Carolina. Now, trust me, I understand how frustrating it could be trying to find answers for your health concerns, and so how convenient it may seem to go online to get answers to questions. However, unfortunately, I think that the access to information that we have today kind of creates the illusion that coming to decisions about what could be going on to your health is a simple case of ask what the symptoms are and then come to the diagnosis. The reason this is actually very problematic is because the truth is that the same symptoms can have multiple different explanations, and different symptoms can have one single unifying explanation. How do you tease those out? How do you know which pieces of information are relevant and what pieces of information are just noise? How do you know which pieces of information are dangerous? How do we know some of that information is really just a coincidence? In order to come to an effective conclusion, we need to have a particular framework with which we approach these questions. And one of my favorite things to do, especially for new patients, is explain exactly how that framework works. See, the thing is, part of our job as clinicians is to develop what we call a differential diagnosis. The differential diagnosis is a list of all possibilities that come to mind whenever we are evaluating a patient's concerns. I like to say that our differential that we come up with is a reflection of our training, our experience, and even our philosophy of medicine. The thing about the differential is that we're supposed to come up with it the moment we hear whatever your concern is without any additional pieces of information. The example I like to give is if you tell me that you have a headache. The moment you say you have a headache, my head rushes with a differential. It could be anything from a simple tension headache, a migraine headache, blood pressure issues, sinus infection, TMJ, tumors, meningitis, autoimmune conditions, all kinds of different things that it can be. Now, the point is I come up with this list the moment you say you have a headache. That doesn't mean that I'm diagnosing you the moment you have a headache. It means that I'm creating my differential. Then, as we speak, this is what guides the kinds of questions that I ask. I ask you questions, sometimes questions that seem strange, specifically because I'm working on a differential. If you've ever walked in complaining about a certain body part bothering you and the clinician starts asking you questions about something and some other part of the body, there's a decent chance that the reason for that is because they are considering something on their differential that could manifest itself the way you're experiencing symptoms that for you may not seem related at all, but could absolutely be the case. For example, you might come in complaining about a cough that just won't seem to go away. It's the strangest cough. It comes on at random times. You've never had a fever. You've never had a chill. Sometimes a runny nose, sometimes you don't. And then your clinician starts asking you, do you find that you often burp a lot? Do you sometimes feel nauseous after eating foods? Do you notice that sometimes you wake up in the morning and your throat is sore, but it gets better throughout the day? The reason for these questions is because on the list of the differential for cough is actually acid reflux. There are types of reflux that can cause irritation in your airway, causing you to cough. The challenge for us as clinicians is to always be working on refining our differential, starting with enhancing how wide our net can go when we're thinking in the beginning of the process, because you can't diagnose what you don't consider. This is perhaps one of the key limitations of relying on the internet or on forums for coming up with solutions, because the truth is that, like I said before, the symptoms alone create this long list of possibilities, And because there are overlapping symptoms for different types of disorders, if you don't have a differential that you're considering, you don't have different criteria to rule things in or rule things out. Because of the differential diagnosis and the list of possibilities that we ask the questions we ask, and also it's the reason why a thorough physical exam is so important. I know we live in an age today where people are being convinced that what they need to do is order expensive labs or order expensive imaging, and that's going to take the place of a good physical exam. In fact, I have some patients who are under the impression that you can practice good thorough medicine just by going through telemedicine. But the truth is that while there is absolutely a time and a place for all of those things, if the differential includes something that does require physical examination, it becomes very important. A lot of people are concerned about the possibility of autoimmune disorders, and sometimes those disorders are not easy to find on lab studies, and it's not clear when we're taking history. But on physical exam, we can find subtle skin changes or changes in the mucous membranes, or we can hear things on auscultation that may point us in a certain direction. And even better, a good physical exam that doesn't find markers of those things reduces the likelihood that those are the things that we're dealing with. It's this differential that guides our recommendations after we've done our exam, after we've taken a thorough history, for any additional testing or any imaging that needs to be ordered, or if we need a specialty referral because you may need some type of surgery. A lot of people are curious about testing for this or testing for that, and I'm with it. I like to tell my patients I'm not a gatekeeper, but because I own a direct primary care practice, cost is important for a lot of my patients who do not have health insurance. And so the last thing I want to do is have them incur an unnecessary cost. If people want to know just because they want to know, that's perfectly fine. But when I'm recommending a certain test, some study of some sort, it's because I have the differential that I'm trying to refine. And even though I've been thorough in my exam, even though I've been thorough in my interview, there may be some pieces of information that lab studies are going to address. The point here is that medicine and clinical decision making isn't a simple symptom disease diagnosis plug and play. It's the process of refining the differential diagnosis by taking all this information in, and you just can't replicate that by leaning on the interwebs to do so. So hopefully it's clear why practicing medicine, diagnosing the problem, is not a simple case of what's the symptom, this is the condition. There's a whole process that goes into this to ensure that we're being thorough, that we're being safe, effective, and we're not causing you any waste of time, money, or worse, right, harm to your health. With that being said, I already addressed in the beginning that I understand the impulse and the temptation to want to do this. What I want to do now is give you some recommendations that may be more helpful than jumping onto the Google machine or Dr. Chat. You're going to want to write this down because ideally this is going to be something that you can carry with you into the exam room so that you can have a productive conversation with your provider. First, it helps if you have the answers to the following questions. When did your symptoms start? Have you taken anything for your symptoms? Did it help at all? Did it make things worse? Have you noticed any things that in fact do make it worse, right? Describe the quality of your symptoms. If it's pain, is it a sharp pain? Is it a dull pain? If it's unwellness, if it's general unwellness, do you feel tired? Do you feel like you can't catch your breath? If it's stomach problems, are you nauseous but you haven't thrown up? When you say nauseous, do you mean like, something's in your throat, or do you mean the idea of eating is off-putting, right? Do you feel or are you experiencing anything anywhere else around the same time that the symptoms presented? And then how bad, on a scale of 0 to 10, how bad do you think these symptoms are? Often 0 being not bad at all, and 10 being it's the worst time of your life ever. And lastly, are the symptoms constant? Are they coming and going? Do you notice a pattern? Have you paid attention to anything that seems to trigger the symptoms? Those questions are the ones that most clinicians are going to want to know to get a sense of what could be going on. And having those ready on hand can make it much more efficient, reduce stress for you trying to remember all those details, and prepares you for the kind of things they're going to ask you. But the other thing that I think will really empower you is having questions prepared for your clinician. One of my favorite questions to encourage people to ask is, what is your differential? In other words, you're saying, what are the things that you've considered? What else could it be? If you're interested in a certain test, maybe you're curious about certain labs, feel free to ask the question, would it be useful if we ordered these tests? Or in fact, why wouldn't it be useful? These are questions that you as a patient are absolutely entitled to know the answer to. If you read something online, if you're particularly concerned or curious about something, it's helpful if you carry a link with it in your phone, or if you're able to provide. For me, my patients, because they're able to text me or email me, they can literally send me the source of information that they have for me to look into. The idea here isn't to play gotcha games. The idea is to ensure that you and your clinician have a fruitful conversation. By having your answers prepared for the clinician, it makes it more efficient for them, relieves stress for you. And by having these questions ready, you're not being disrespectful. This is you getting invested in your care and helping you make informed decisions for your medical care. By keeping all this in mind, my hope is that you will have more productive encounters with your medical practitioners. And if you're in Fayetteville, North Carolina, and you're interested in a different kind of primary care, we would love to have you here. And you are always welcome to visit us at our website, truecaredpc.com, or to text us at our central line, 910-758-1769. God bless you guys. Thank you so much for taking the time to watch this, and I hope you have a wonderful day.